Dr. Monica Gandhi is here with us. She's a professor of medicine and the associate division chief of the Division of HIV, Infectious Diseases and Global Medicine at the University of California at San Francisco. So this seems like it's a good thing, making Narcan more affordable, is it?
This is a good thing. So essentially, we had such an incredible increase in opiate overdoses in 2021 and the first half of 2022. This is probably the pandemic, deaths of despair, unfortunately, people using more, our synthetic opioid problem. Narcan reverses those effects. It is incredibly life-saving, but the problem is it was available with a prescription before this. Now you can get it over the counter and the drug company is going to make it cheaper. This means hopefully we'll have wider availability without a need of a prescription, so that if you're with someone who unfortunately may overdose, you can quickly administer this under the tongue or in a way up the nose, in a way to get it to someone quickly.
Right. It can save a life if used in those critical moments. $125 down to $50. It's still a pretty expensive drug. Do we anticipate that insurance will cover any of that?
It should, in the sense that preventative healthcare is still funded under the ACA. We're having some challenges to that, but hopefully it will be. And it's available without a prescription. So that means you literally can go into a drugstore and get it. You're right. This is a little too expensive right now. It needs to be even cheaper. And the drug company is responsible for that.
Yeah, you almost wonder if it's something that you give out for free, if it can do the trick. Another headline, Dr. Gandhi, that we're following this morning, thousands of people say that they have developed ringing in their ears after getting the COVID-19 vaccine. This is something called Tinnitus. I'm not sure if I'm saying that right.
Tinnitus, right.
Yes, okay,
right.
good. An associate professor from the College of Medicine at the University of Arizona said he believes that the vaccine could be interacting with a pre-existing risk for this hearing condition. The CDC, however, says there's no evidence suggesting a link here. So first I had heard of it, COVID and ringing in the ear. Is this a thing?
You know, I think it is associated with the vaccine, actually, because this has been something that has been reported from the beginning. There's just a consistency to this concern. There's been 16,000 reports filed to the CDC saying, I got the vaccine and I got tinnitus. I know the CDC is saying they're unconcerned, but it's actually really important to increase trust in vaccines, to look at any possible side effect and acknowledge the community that's having that side effect. This was true of myocarditis, which is inflammation of the heart. We've discussed that in young men. It's a thing, it's real. And acknowledging side effects of any medication or vaccine just increases trust. So I would not dismiss this community and say, oh, there's no tinnitus. This has been a pretty consistent report from the beginning of the vaccination campaign, and we need to look at it more closely.
So why do you think that they're not being more forthcoming about that and some other possible links, dizziness, headaches to the vaccine?
You know, I think, and we've seen this, our public health, our trust in public health right now is pretty low in this country. It's about 37% trust in the CDC. I think there's this thought by public health that if you acknowledge nuance, that you're going to sow doubt. I completely think the opposite, that if you acknowledge any problems or side effects, that actually increases trust. Maybe you don't need a booster. If you've had a side effect, why would we give you another dose? Let's look at you. If you have a family history of tinnitus, let's be more careful with you. Think about another vaccine formulation. I think it's this idea that they will sow doubt, and I think that's not incorrect. Nuance is a good way to manage any pandemic.
Right, and giving people the facts and information, being transparent, also quite beneficial. There's some news on the flu. People who get the flu could be 6 times more likely to have a heart attack in the days, weeks, or months following that diagnosis. There are some researchers in the Netherlands. They looked at 26,000 influenza cases over a decade. They found 401 of those experienced at least one heart attack within a year of coming down with the flu. This may be a result of inflammation. What do you know?
Yes, you know, actually, this speaks to the question of long symptoms after any viral pathogen. This actually is a very important story, because what this means is that with severe disease, with any virus, influenza, COVID, RSV, you can get after effects if you have severe disease. It's important to say this study showed that these were patients who are hospitalized with influenza, so with severe disease, and then they're more likely to get the inflammation and likely a heart attack. That's actually true of any viral pathogen. When we think of the word long COVID, What we should really be thinking about is reducing severe disease from any viral pathogen, because you're more at risk for the innate immune response that can cause inflammation and other effects. So to me, it really speaks to the pathophysiology of trying to reduce severe disease for any virus, influenza, SARS, anything.
Right. So I guess to that point, is there steps that people should be taking if they've had one of these severe diseases, so a really bad bout with the flu? Should they be getting their heart checked as a preventative measure?
They should definitely speak to their doctor about, I saw this study, I had severe flu, I was hospitalized, should we be watching me more carefully? There were limitations to the study, it was observational, but especially if you have risk factors for heart disease, you should be followed more closely after a severe bout of influenza.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.